Good afternoon, and thanks for joining the ZOHU call. The webinar will begin soon. Please stand by. Good afternoon. I'm Keisha Bohannon, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Center for Disease Control and Prevention. On behalf of CDC's One Health office, I'm pleased to welcome you to this Zoonosis and One Health Updates call on April 3rd, 2024. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources for each presentation are available on our website at cdc.gov/onehealth/2024/april.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives: identify an implication for human, animal, and environmental health, identify a One Health approach strategy for prevention of public health threats, identify a One Health approach strategy for detection of public health threats, identify a One Health approach strategy for responding to public health threats, and 5, list 2 ways to improve collaborative practice across the public healthcare team. Next slide, please. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of unlabeled products under investigational use. CDCR planners, presenters, and their spouses wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed content to ensure there is no bias. The presentations will not include any discussion of unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/onehealth/ZOHU/continuing education. Please note, as of January 1st, 2024, you'll need to visit CDC Train to receive continuing education for all new webcasts and web on-demand courses. The course access code is ZOHU Webcast. It's course access, also known as the password on CDC Train. And to receive free CE for today's webcast, sign in or create an account at train.org by May 6, 2024. A captioned video of today's webinar will be posted on cdc.gov/onehealth/2024/april.html within 30 days. Free CE for the web on-demand video of today's webinar will be available until May 7th, 2026. Next slide, please. Before we begin today's presentations, Dr. Rochelle Medford, One Health Office ORISE Fellow, will share some news and updates.
Thanks, Keisha. Good afternoon, everyone. Thanks for joining us for our April ZOHU call. Please remember to share the ZOHU call website link with your colleagues from the public health, agriculture, wildlife, plant, environmental health fields, and other sectors so we can let them know about the live webinars, video recordings, and free continuing education that this webinar offers. Before our presentations start, I'll take a moment to share some updates and resources. You can find links to these resources in today's ZOHU call email newsletter. If you aren't yet subscribed to the newsletter, please sign up using the link at the top of the main ZOHU call webpage so that moving forward, you can get ZOHU call updates. In today's newsletter, we highlight several recent publications, including one titled "The Emergence of Rocky Mountain Spotted Fever in the Southwestern United States and Northern Mexico Requires a Binational One Health Approach," and another titled "Dogs on the Move, Estimating the Risk of Rabies in Imported Dogs in the United States, 2015 to 2022. Next slide, please. Continuing with publications, we've highlighted several MMWRs, including Surveillance of Waterborne Disease Outbreaks Associated with Drinking Water, United States 2015 to 2020, and an outbreak linked to morel mushroom exposure, Montana 2023. Next slide, please. Lastly, we've highlighted mortality associated with SARS-CoV-2 in non-domestic felids, and the use of environmental data in descriptive and predictive models of vector-borne disease in North America. Next slide. Here we've highlighted announcements and resources, including the Plant Materials Program 2023 Report of Activities and recent CDC updates to respiratory virus recommendations. Next slide, please. Additional resource highlights include a press release on highly pathogenic avian influenza A H5N1 virus infection reported in a person in the US, and a podcast from the Lancet Microbe, a conversation with Nancy Chow on sporotrichosis. Next slide. Some April observances that may be of interest include National Public Health Week and National Wildlife Week happening April 1st through 7th, National Dog Bite Prevention Week, April 7th through 13th, and skipping down the list, World Veterinary Day on April 27th. Next slide, please. Finally, we've shared several ongoing outbreak investigations, including the Listeria outbreak linked to queso fresco and cotija cheese. Next slide, please. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases, and find details about ongoing U.S. outbreaks on the CDC websites linked from today's newsletter. Our next ZOHU call will take place on May 1st, 2024. Please continue to send presenter and topic suggestions for future presentations, as well as news from your organization to zohucall@cdc.gov. That's ZOHUCALL@cdc.gov. Next slide. Now I'll turn it back over to Keisha. Thanks so much.
Thank you, Rochelle. You may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. We've included their email addresses on this slide, on the ZOHU Call webpage for today's webinar, and in today's email newsletter. Now we can begin our presentations. Next slide. Today's first presentation, Per and Polyfluoroalkyl Substances, Understanding Exposure and Adverse Health Outcomes in People and Their Pets, is by Dr. Heather Brake. Please begin when you're ready.
Thank you so much, Keisha, and good afternoon, everyone. So my name is Dr. Heather Brake, and though you may know me as the Communications Director for CDC's National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry, today I'm going to speak to you as a graduate student. So just before the COVID pandemic started, I enrolled in graduate school at Michigan State University College of Veterinary Medicine, and this presentation is about the preliminary results of my dissertation study. I received no funding nor in-kind benefits from CDC in pursuit of this degree, and my findings are independent of the agency. Next slide. I'm excited to open this month's ZOHU call with a talk about PFAS. The term PFAS, otherwise known as forever chemicals, is probably a familiar word to you. In today's short talk, we are going to explain what PFAS are, what they are used for, talk a little bit about how widespread they are, and then go into routes of exposure and some of the preliminary results of my pilot study. Next slide. So the term PFAS actually refers to a large group of per and polyfluoroalkyl substances with some important things in common. PFAS generally have a polar head group that is hydrophilic and a hydrophobic tail. But what gives PFAS their superpowers are the very strong carbon-fluorine bonds. Their unique chemical structure provides this family with the highly desirable qualities such as thermal and environmental stability and the ability to repel oil, water, and stains. And this has led to widespread use in manufacturing and consumer products. PFAS are bioaccumulative, and they are called the forever chemicals because they are extremely resistant to degradation. You can see two examples of the most common legacy PFAS to the right of the screen. On the top is perfluorooctanoic acid, or PFOA, and below is perfluorooctane sulfonic acid, or PFAS. Next slide. So how are PFAS used? Well, to be honest, in practically everything. So PFAS was first used by the military to protect metal from radioisotopes in the atomic bomb. Following World War II, the chemicals use greatly expanded. Manufacturers began using the chemical and its derivatives to coat wires, reduce friction on gears, seals, and gaskets, as a component of ski bindings, and to protect fabrics. One of the most notable uses of PFAS is as the principal component of a nonstick surfaces for cookware. PFOA was introduced to help smooth out the Teflon coatings on pots and pans. And for those of you in Minnesota, you might recall that the roof of the Hubert Humphrey Metrodome was made out of 10 acres of Teflon coated fiberglass. So that's a lot of PFAS. PFAS, on the other hand, was a key component in Scotchgard. So this chemical and its derivatives were used for paper and fabric coatings, anti-fogging agents, circuit boards, and many other things. So up into 2001, both of these chemicals were used as surfactants in aqueous firefighting foams. When I checked EPA's CompTox dashboard yesterday, it listed just over 12,000 species of PFAS. Today, PFAS are used in manufacturing, medical devices, paper and fabric coatings, paints, cosmetics, and even medication. Because of its ability to travel in the air, on dust, and in water, there may not be any place on Earth that hasn't encountered some amount of PFAS. Next slide. There are many ways that people and pets are exposed to PFAS. One of the most well-known routes of exposure is through contaminated water. But PFAS can also be in air and dust. It bioaccumulates and has been found in domestic animals, fish, and wildlife. PFAS can be absorbed into plants, and so has become a problem for some farms that use biosludge as fertilizer for growing animal feeds, and is also a concern to home gardeners wondering if they had used contaminated water for their produce. As we mentioned before, PFAS is also a component of consumer products, such as protective coatings on food containers, food wrappers, clothing, and cookware. And we have also learned that PFAS are present in many types of medications. I know I'm painting a somewhat bleak picture here in terms of exposure, but to be fair, consumer products contain very small amounts of PFAS, and most people will never know that they've ever been exposed, nor will they ever see adverse effects. However, there are those areas around the world which suffer greater contamination, and these are generally military installations or manufacturing sites where large amounts of PFAS have been used or are continuing to be used. As the EPA and individual states expand their testing, we are becoming more aware of these areas in the United States. Next slide. According to ATSDR's recent publication, Information for Clinicians, PFAS exposure has been associated with increased cholesterol levels, small decreases in birth weight, lower antibody response to vaccines in children, kidney and testicular cancer, and there is evidence of pregnancy-induced hypertension, changes in liver enzymes, and potential thyroid disease or dysfunction in people. Next slide. In animals, we're starting to see a similar picture. There are very few health studies involving companion animals and PFAS. In fact, there's just very few studies, period, involving animals. However, what we're finding in the literature is evidence of an increased liver weight and size, changes in kidney and liver function, reproductive changes, particularly in laboratory rodents, including smaller litter sizes and failure to thrive in the pups. And in cats, there have been published reports of altered thyroid hormones with potential hyperthyroidism and possible respiratory effusion. Next slide. So, knowing that there are potential similarities in biological effect, we asked the question of whether pets could be used as sentinels for PFAS exposure in the household. As you know, common use of animals as sentinels for human health dates back to the late 1800s with the use of canaries in coal mines. The thought was that because the metabolism of birds is much faster than that of humans and the dose at which canaries would react to the toxins was much smaller, any impact on the birds would allow early indication of toxic fumes in the mines. Seeing signs of distress or fainting in the birds prompted miners to immediately evacuate before succumbing to similar adverse effects. So in this case, though we do not yet know the dose response of PFAS exposure in companion animals, we do know the half-life of PFAS in dogs ranges from days to weeks compared to years in humans. This could mean that, like canaries, changes in body systems in overall healthy dogs exposed to toxic substances may appear months or even years before their human counterparts. Due to indoor dogs and cats largely living on the same flooring and furniture, breathing in the same air, and drinking the same water as their human counterparts, we decided to explore whether or not pets could be on the front lines of detecting household contamination. Next slide. Because the Division of Environmental Health at the Michigan Department of Health and Human Services was already working in the area to conduct several PFAS studies among people, we chose to conduct a pilot study and recruit pets from Belmont Rockford and Parchment Cooper Township. Both municipalities are in West Michigan, located near the cities of Grand Rapids and Kalamazoo, respectively. In order to characterize the PFAS in pets and the routes of exposure, our veterinary nurses traveled to 15 different homes. They collected blood from 28 pets and environmental samples, including household dust, pet food, and water from the pet bowls. And I will interject here and say that we had a very hard time collecting blood from cats. And so we chose to focus on dogs. I think we had one cat that wanted to participate in our study, and that was it. Next slide. Our blood samples were split between the Michigan Department of Health and Human Services Laboratory for PFAS testing and the Michigan State University Veterinary Diagnostic Lab for blood chemistry analysis. We chose the MDHHS laboratories for our PFAS testing because we wanted to have consistent results with the human samples they had been testing for their Michigan PFAS exposure assessment and health study. It was important to us to be able to see if there was any association between people and pets living in the two areas of interest. In addition to the general chemistry panel, we asked the Veterinary Diagnostic Laboratory for additional thyroid testing in our pets. Before we go to the next slide, I want to tell you that the household dust was graciously tested by Cheryl Murphy's lab at Michigan State University, but we have not yet been able to test the pet bowl water or pet food yet. In the next few slides, I'm going to share our preliminary data from this study. Next slide. So we haven't published this yet, and because we're still analyzing some of the environmental samples in our study. But as you can see in our pilot test, when we analyzed blood and household dust for PFAS and compared our data with that from the 2021 Michigan PFAS Exposure and Health Study, we found that 100% of all samples contained at least some PFAS, and nearly 100% of the samples contained PFOA. As noted earlier, these two PFAS are typically used as water, oil, and stain repellents, but were phased out of production years ago. PFAS was notably used in Scotchgard, where PFOA was used, remember, in the manufacture of Teflon and Gore-Tex. PFNA and PFDA are used in food packaging materials, floor polish, cosmetics, fabric coatings, sandwich papers, and many other things. PFH excess is used to treat leather and fabrics, but is also found in printer ink. Next slide. On this slide, though it is small, you will see the different concentrations of PFAS we found in our pilot study. The blue represents the 95th percentile serum concentration for dogs. The red represents the 95th percentile serum analyte concentration from people participating in the MyPest study, and these are the results from the 2021 collection. And the yellow represents household dust. Though we tested 40 different species of PFAS, this graph represents the 13 species of PFAS that were found across all of our variables. Thankfully, the concentrations of most types of PFAS are relatively small. However, you can see that the amount of some of the PFAS, such as PFOA and PFOS, are found in much larger quantities than the others across the species. I also want to draw your attention to PFBA here. We didn't talk about PFBA on the previous slide, but you can see we found quite a bit of it in household dust. PFBA is another PFAS used in fabric coatings, and so could have been used as protective coatings on furniture or carpet. Next slide. So what does this all mean? How do our results correlate with each other? And are we on track for trying to figure out if household pets could be sentinels for human PFAS exposure? I would say yes, maybe. When we conducted a Pearson correlation to calculate the strength of the relationship between our variables, we found that there was a weak correlation between human results and what we found in household dust. A surprisingly negative correlation between what we found in pets and household dust, but a moderate correlation between pets and people. To me, the data is showing that although household dust could be a contributor to a lot of the PFAS we are seeing in pets and people, it doesn't represent all of the exposures. As we look at these results, I do have to remind everyone that this is based on 28 samples collected from 15 households in West Michigan. Also, we do not know the dose response curves for PFAS in animals. Adverse effects following exposure may depend on many different factors, including dose, health, and age of the individual, or length of exposure. We are currently exploring how pet blood chemistry results relate to individual PFAS concentrations and plan to test the pet food and pet bowl water this summer. We hope to pursue a larger study over the next year. Next slide. Thank you for listening, and I'm reminded to tell you that if you're interested in joining other veterinarians in this type of work or learning more about how your expertise can support food safety and public health, you should join the American Association of Food Safety and Public Health Veterinarians. Thank you, and I look forward to any questions at the end of the hour.
Thank you, Dr. Brake. Thanks so much for sharing. Next slide, please. Our next presentation, Responding to Avian Influenza A H5N1 Detection on a Hospital Property in Maine, an interdisciplinary approach, is by Anna Kruger. Please begin when you're ready.
Hi, thank you and good afternoon. In December of 2022, 2 Canada geese residing on a hospital property in Maine tested positive for avian influenza A H5N1. Today, I'm going to describe how federal and state agencies and organizations work together to address this issue. But first, I'm going to provide a background on avian influenza itself. Next slide, please. A new avian influenza H5N1 virus from clade 2344b emerged in 2020. There are many different avian influenza viruses, but this specific highly pathogenic avian influenza virus has been of particular concern due to its wild bird adaptation and rapid global circulation. In December of 2021, this new virus debuted in North America, with the first detection in Newfoundland, Canada, followed quickly by a detection in South Carolina. And on this map of the eastern seaboard, these locations are signified by the yellow stars. Next slide. In the US alone, this virus has been detected in close to 10,000 wild birds, and it's also been detected in now at least 24 different mammal species. Note, 2 or more species have been added since the creation of these slides. And it has affected more than 82 million poultry. Next slide. Avian influenza viruses are shed in the feces and the respiratory secretions of infected birds to other birds and mammals through direct contact with those secretions or through inhalation. Next slide. Importantly, these viruses can live in the environment for prolonged periods of time. The length of time could vary by environmental factors such as temperature and humidity, with virus surviving weeks to months under cold and wet conditions. Next slide, please. From January 2021 to February 2024, there have been 23 human H5N1 cases reported from 9 different countries. The World Health Organization defines a case as any person with H5N1 laboratory confirmation. This map shows the number of cases reported by country up to March 20th. Of note, in 2022, the US reported 1 case in a mildly symptomatic responder from Colorado, and just earlier this week reported a 2nd case in a farm worker in Texas. This most recent case is not included in these numbers. In total, the number of human cases isn't particularly high, and the risk to the general population remains low. However, there still is a recognized risk for people who've been exposed, particularly those without proper PPE use. Next slide. This virus has exhibited signs of potential increased zoonotic risk, or the risk of spread from animal to human. Next slide. These signs include limited transmission to humans, transmission to mammals, sporadic mutations associated with mammalian adaptation, and ongoing evolution. Next slide, please. So because of this, reducing threats of and monitoring for zoonotic transmission is essential. To reduce exposure, it's recommended that people avoid direct contact with wild birds and avoid contact with poultry that appear ill or have died, and also that they avoid contact with surfaces that appear to be contaminated with feces. Next slide. Those who do come in direct or indirect contact with confirmed H5N1 are instructed to undergo 10 days of symptom monitoring to ensure proper testing, treatment, and isolation if necessary. Next slide. With the simultaneous involvement of poultry, wild animals, and humans, many agencies and organizations have been involved in the H5N1 response. This slide highlights key contributors to this response here in Maine, including state and federal partners from both the human and animal health sides. Next slide. Ongoing collaborative activities have resulted in coordinated interagency and organizational responses here in Maine. Starting with Maine's first positive backyard flock in February 2022, daily incident planning meetings, which included representatives from many of these organizations, built trust, relationships, and a strong understanding of individual response roles. Additionally, Maine's influenza work group created a subcommittee, further reinforcing and opening up lines of communication for those involved in avian influenza responses. And lastly, we've had multiple opportunities within our state to exercise these roles and determine best approaches through multiple responses, including 20 positive backyard flocks, an unusual mortality event in seals, and many positive detections in wild birds. Next slide. So these established relationships proved useful when H5N1 was detected in a flock of Canada geese residing on a hospital property in late 2022. These geese frequented a pond in the surrounding area between the staff parking lot and the hospital entrance. Here you can see the hospital entrance at the top of the map, the staff parking lot toward the bottom, the walkway connecting the two, and the pond where the geese frequent to the right of the walkway. And of note, this walkway connects city recreational paths and is used by the general public as well as the hospital foot traffic. So unsurprisingly, these geese didn't just stay in the pond, they moved around the area, leaving potentially contaminated feces on the walkways and grass. These feces were presumably being picked up on the feet of those walking through. And the hospital noted that the walkway from the parking garage to the hospital entrance had a particularly large amount of feces on it that were being tracked into the hospital. Remember, avian influenza viruses can be transmitted from bird feces to humans, and the movement of infected feces from one location to another can result in infection of a new flock or other animals. Next slide. So knowing this, we and the hospital felt it was necessary to take action in order to prevent transmission. This included potential zoonotic transmission to staff, visitors, or patients within the hospital and on the recreational trails. Also, preventing people from unknowingly spreading the virus to other flocks or animals, and preventing contamination of the property in the future. Next slide. There are very minimal, if any, examples or recommendations for how best to approach a situation such as this, in which a large number of members of the public may be exposed. So human health and animal health federal and state agencies work together to develop a plan of action, largely adapting the recommendations taken during our previous responses. So ultimately, we came up with these recommendations. First, active monitoring for 10 days following their exposure was necessary for the hospital employee and the state responder who came in direct contact with the confirmed H5N1 carcasses. This is a standard action taken in which the health department facilitates symptom monitoring. Next, rerouting foot traffic away from the potentially contaminated areas, in particular, avoiding use of the walkway between the parking lot and entrance. Wearing proper PPE when handling feces inside the hospital. Increasing surveillance for unexplained influenza-like illness among staff and patients. Subtyping specimens from patients who tested positive for influenza A after admission. Subtyping wasn't performed at the hospital, therefore these specimens needed to be sent to our state lab. Informing staff and visitors of the positive detection through communication methods such as emails from the hospital to staff and signage on the property. Deterring geese by various methods and fencing off the pond. Importantly, we weren't sure how long these mitigation and prevention efforts would need to be in place because it's unclear how long these viruses would remain viable in the environment. Next slide. With the exception of the signage on the walkway and recreational trails, the hospital implemented these recommendations. The heightened response was enforced by the hospital until the pond fencing was built and several large winter storms occurred, displacing the geese and covering the potentially infectious species. Next slide. In the end, no human cases were identified and there were no additional detections in geese. Next slide, please. Following the response, the hospital provided feedback on their implementation efforts. So I'm going to briefly talk about 3 of their key takeaways. First, monitoring for unexplained respiratory illness in patients in order to identify who should be tested put stress on the system caused by the need for increased coordination between care teams. This seemed to be particularly true given this was during respiratory virus season and that the criteria for testing were pretty specific. Secondly, the hospital noted that ongoing COVID-19 mitigation strategies still in place at the time, including masking and staff symptom monitoring, felt like an additional layer of protection already in place for the hospital. And lastly, the hospital set up an internal goose management work group whose primary goal was to determine effective ways to deter geese from the property. The hospital found this to be an effective way of information gaining and problem solving. In our last conversation with the hospital, months after this event, the work group was still meeting regularly. Next slide. One of our biggest takeaways from this response is that it still remains unclear how best to approach situations such as this. However, given the willingness of the facility and the relative ease of implementation, if a similar situation were to happen again in Maine, we'd probably take a similar approach. Given the number of potentially high-risk patients in the hospital, that there was confirmed H5N1 on the property, and that we knew people were coming into contact with the potentially infectious species, we felt that we had to act. We know that our ongoing interagency relationships allowed for a consistent and thorough response. However, we don't know whether these efforts were effective or frankly even necessary. Nonetheless, we do think it's important to highlight this situation and encourage others to think about how they would approach something like this. Next slide. In the end, we believe that a better understanding of the virus viability in different environments would help provide clarity for future responses, and that establishing best practices for response to H5N1 in settings not traditionally affected by avian influenza would be useful for others facing similar scenarios. Next slide. All right. Thanks to all who helped with this response, and thank you for listening.
Thank you so much. Next slide, please. Our final presentation, multi-state outbreaks of Salmonellosis linked to contact with backyard poultry, United States, 2015 to 2022, is by Dr. Sean Stapleton. Please begin when you're ready.
Thank you so much. Hi, everyone. My name is Sean Stapleton. I'm a veterinarian and an epidemiologist working at CDC as part of the enteric zoonosis activity. And our team is responsible for coordinating response to multi-state outbreaks of human enteric illness caused by pathogens like Salmonella, E. coli, and Campylobacter. And our team specifically specializes in coordinating outbreak response on the multi-state level when these outbreaks are linked to contact with live animals. And today I'll be presenting on a retrospective analysis of a long-standing issue, which is backyard poultry-associated Salmonellosis outbreaks. This will cover data from multi-state outbreaks in the US from 2015 to 2022. Next slide. So first, just a little snapshot to characterize the bigger picture for enteric illness outbreaks that have been linked to live animal contact in the past. This is just a little bit of data from 2017 to 2021 for all enteric outbreaks that are multi-state in nature that we have been able to link human illness to a specific type of animal. contact with that type of animal. And what you can see here is that most of these outbreaks have been linked to backyard poultry in comparison to the various other types of outbreaks that have been linked to animal contact. Backyard poultry have the lion's share of responsibility in terms of these outbreaks. Next slide. And so now to just give a very quick 30,000-foot view of how do we detect these outbreaks and how do we determine that a specific type of animal is shedding the outbreak pathogen and leading to human illness. So in the United States, whenever anyone is diagnosed with a pathogen like Salmonella, there are a couple of things that have to happen on the public health response side. So first off, one of those things is that when a person is diagnosed, an attempt needs to be made to obtain an isolate from a specimen from that patient. And if Salmonella can be isolated, then we perform whole genome sequencing, and this is done by public health laboratories. Whole genome sequencing to determine what strain of Salmonella we're dealing with. That gives us what we colloquially refer to as the DNA fingerprint. And when we detect that multiple people in different locations around the same time frame have been infected with the same strain of Salmonella, that implies that they could have all acquired their Salmonella from a common source, and that we might need to intervene in terms of public health to prevent more people from getting sick. So that whole genome sequencing data, next slide, that gets uploaded to PulseNet, which is the network of laboratories that are monitoring for enteric illness in the United States. This is our surveillance system. And our surveillance system is continually looking at the whole genome sequencing data that is coming in and making determinations about the incidence of different strains of those pathogens. And when certain algorithms are met and we detect that we might have what we call a temporal cluster, so an increase in incidence of people in the US within a given time frame that have the same strain of Salmonella, then PulseNet will notify a team like ours. Next slide. So a team like ours at CDC, when these outbreaks appear multi-state in nature, will review preliminary information and then coordinate between various partners at the state, local, tribal, territorial health departments, as well as federal agencies, academic partners, and industry partners to collect more information to learn about why are people getting sick, and if we find out why people are getting sick, is there anything that we can do to prevent more people from getting sick and stop the outbreak? Next slide. So now to move on specifically to outbreaks that we have linked to contact with backyard poultry. And backyard poultry is a pretty broad term here. It's loosely defined as chickens, ducks, turkeys, or similar poultry that are privately owned. These are birds that are at individuals' houses. It's separate from what we classically think of in the commercial food system producing meat and eggs for human consumption. Backyard poultry are essentially living at private households. Next slide. So when we've analyzed our data retrospectively, and we're always analyzing this data prospectively in the course of outbreak investigations, but from 2015 to 2022, there were 88 multi-state outbreaks, which accounted for 7,866 outbreak-associated illnesses. That's the blue bars that you're seeing. And what you can see is that there is a general upward trend in both the number of outbreaks that are detected and the number of illnesses. In recent years, pretty much each year we detect 1,000+ outbreak-associated illnesses that are attributed to contact with backyard poultry. Next slide. What serotypes are associated with these outbreaks? So just a little bit of information about Salmonella serotypes. They're essentially just a shorthand way of designating the strain. There's over 2,000 different serotypes that have been identified. But what you can see on this slide is that the serotypes that are shown Salmonella enteritidis is the most common Salmonella serotype that is identified in these backyard poultry associated outbreaks. But Salmonella hadar, infantis, branderup, typhimurium, these are all in the top 5, some common serotypes that we see. Next slide. When do people get sick? When do these outbreaks occur? Most people, what you're seeing on the slide is a modified epidemiologic curve showing patient illness onset. And what you can see is that most people have their illness onset in middle to late spring into the summer around April or May. And this coincides very closely with increased availability of backyard poultry in the United States. You could purchase backyard poultry if you're willing to order them online and have them shipped to your house most times of the year. But retail stores such as agricultural feed stores really only generally market and have backyard poultry available on the shelves during the spring through summer through fall months, not during the cold time of year, such as winter. So as stores have more availability, somewhere around March in most places, generally before Easter, most stores will have even promotional events such as Chick Days to sell their poultry that they have newly on the stores for that year. And then you can see approximately a month to 2 months later is when we see our spike in illnesses. Next slide. So because that figure looks like an iceberg to me, I thought this would be a good time to kind of take a brief pause and mention a limitation of our surveillance system. We know that we do not capture 100% of enteric illnesses in our surveillance systems for some pathogens in the United States. There's various things that impact that, but what the most recent published estimate tells us is that for every one case that we identify within our surveillance system, there is as many as 29 others out there that we didn't detect. And that might be because somebody got infected with salmonella and they didn't necessarily need to seek out healthcare. So they never went to a healthcare provider, or they went to a healthcare provider and that provider decided that they didn't need to perform any diagnostic tests to determine what the cause of that person's infection was. Or they performed the test and it came back up as say a false negative. Or we had a positive preliminary test result and we weren't able to actually isolate the pathogen. So there's many different limitations that kind of lead to this provided estimate just based on the biology and known limitations of our diagnostics. But just keep that in the back of your mind whenever you hear outbreak associated data. This isn't just specific to backyard poultry. This encompasses all outbreak data, is that what we're finding during our outbreak response is just kind of the tip of the iceberg, if you will. Next slide. Where are these backyard poultry associated outbreaks occurring? Pretty much everywhere. Every year we identify outbreak associated illnesses in almost all 50 states, plus Washington, D.C., plus Puerto Rico. Backyard poultry are available for sale in pretty much any state. And like I mentioned, you can order them online and have them shipped to your house. And you can see that there are certainly some hot spots shown in the dark blue and the light blue color. Next slide. Children are overrepresented in these outbreaks. 24% of illnesses were in children less than 5 years of age. Next slide. And people 65 years of age or older were more likely to be hospitalized, that's the solid line, or develop bloodstream infections, that's the dotted line. And each of those lines show the proportion of people within each age group that were either hospitalized or had a bloodstream infection reported. And you can see that that increases as the age group increases. Neither of these findings, either as it relates to children or as it relates to people older than 65, is specific to backyard poultry. We know that certain groups, including children, including people older than 65, people who are pregnant or people who are immunocompromised, are at increased risk of acquiring infections like salmonella infection or experiencing a severe outcome like hospitalization. Next slide. When we interview people and we collect information about the types of foods that they ate or where they traveled or their sources of water or the animals they contacted, in backyard poultry associated outbreaks, most commonly, the patients are reporting contact with backyard poultry. And that ranges from, depending on the outbreak, 60 to over 80% of patients telling us before they became ill, they contacted backyard poultry. And if I were to go out to the general public and ask people, did you contact backyard poultry in the past week? I would expect about 5 to 15% of the people I talk to tell me, yes, I contacted backyard poultry. So what we find in the general healthy population in terms of backyard poultry exposure is significantly lower in these backyard poultry associated outbreaks. And that's one leg of epidemiologic evidence that we collect to make our conclusions that people are likely getting exposed to outbreak pathogens via backyard poultry contact. And most people report that the types of poultry that they contacted were baby poultry. Next slide. And when we ask people what types of contact do they have with backyard poultry, each year we find that people report behaviors that are at higher risk of Salmonella transmission, including kissing, snuggling, or allowing poultry inside the home. And you can see that those behaviors have a relatively steady incidence over the years. Next slide. And people do see their backyard poultry as pets. You might have classically thought of backyard poultry as a barnyard animal or something that lives on farms, but more and more people are viewing these animals as their pet. So they get brought inside, or they play in Barbie's dream house, or they swim in the bathtub. And unfortunately, even though they look healthy and clean, they could still be contaminating the household with a pathogen like Salmonella. Next slide. So we want people to own and interact with backyard poultry and raise them at their homes safely. So CDC is continually developing resources to educate people about this risk and disseminate information about how they can keep backyard poultry at their home and reduce their chance of acquiring Salmonella. So we have a number of resources. We also every now and then will conduct focus groups to hone our communications messaging. We try to make these as available to as many groups as possible by translating them, say, into like Spanish. And whenever there are outbreaks that occur, we also make sure that those are publicized in the media so that people are aware of the occurrence of those outbreaks and can draw attention to this public health issue. Next slide. But also feed stores and hatcheries, those who breed and sell poultry, play a crucial role both in educating the people who are buying poultry. So we partner very closely with these groups. We also work with them to develop and enact biosecurity practices that could reduce the spread of Salmonella among backyard poultry throughout the industry. So this is also a key partner in terms of preventing this problem. Next slide. So this was a big overview of a longstanding problem. I welcome any questions, and please feel free to reach out to EZA@cdc.gov if you have any. And also the educational resources that I mentioned are available at CDC's Healthy Pets, Healthy People website. So you can access them there. And I hope that the data presented in this publication will be, or in this presentation will be available in a peer-reviewed manuscript here in the next month or two. Thanks so much.
Thank you so much, Dr. Stapleton, and thanks to all of today's speakers for sharing your informative and timely presentations. Next slide. Oh, you can see on this slide. We have time for a few questions. As a reminder, if you have a question, please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic. Okay, so we can go ahead and get started, and we'll just go in order with Dr. Brake. And I think I'll mention two questions together and see if you can provide an answer. So the first question was, the PFAS study in pets is admirable. Excuse me. One statement, the PFAS study in pets is admirable. Might additional species and or a larger cohort or cohorts be studied by using samples retrieved from one or more veterinary or academic diagnostic labs using residual specimens on the day they are due for routine disposal? That's one person's question. And then another similar question, if the PFAS, if the significance of PFAS levels in people is the target of the research, why not just measure PFAS levels directly in humans and skip the correlation via household animals? So Dr. Brake, can you provide an answer?
Yeah, thank you. And thank you for the question. So to answer both questions together. So yeah, our ultimate goal is to protect human health and particularly the health of small children. But we chose to study dogs and cats because they have similar behaviors to small children, meaning that they play and sleep on the floors and they have the same, kind of hand to mouth or mouthing behavior. But testing for PFAS is quite expensive and really cost prohibitive to many people. So what we were trying to establish is whether or not there was a blood chemistry pattern in pets, such as maybe elevated liver enzyme combined with elevated kidney or increased lipids that the veterinarians could pick up on in routine blood chemistry panels. And then if we could pick up on a pattern that that the veterinarians could see, then that could indicate that there was a significant PFAS exposure in the home. And at that point, the pet owner could then choose whether they wanted to pay for testing for the human inhabitants of the home. And yeah, we could certainly expand the study to additional species of animals, but we wanted to focus on dogs and cats because they're living in the household with the families and should be exposed to the same household contaminants. So we chose to visit the homes because we wanted to further understand the exposures that happen in the home. And we know that Michigan Department of Health and Human Services had collected drinking water from many homes in the areas of the study, but most of the homes had long since had their water ameliorated. And so the dogs would most likely not have been exposed to the tap water. So it was important for us to actually be able to go to the homes and access the families of our participants so we could ask them questions and collect environmental samples from the home just to get a broader picture of the different ways that pets may be exposed.
Thank you. Okay, and we will move on to Ms. Kruger on avian flu. Let's see. One question that we have that came in was, what was the trigger to test the geese for H5N1 at the hospital? And I think you touched on this in your closing, but maybe you could provide an answer for that question.
Sure, yeah. So the hospital staff had noticed 2 deceased geese on the property from this population that kind of just lived on the property. So they were very vigilant and reached out to our animal health folks who decided, just knowing how, the avian influenza virus is out there, that it was worth testing. And so we did.
Okay, and similar question came in on, so given the concern for foot traffic as a source for mechanical movement of infectious fecal matter into the hospital, was the establishment and maintenance of foot baths at the hospital entrance considered as a simple means for reducing this route of contamination?
Hi, yeah, thanks for that question. So there was discussion around using foot baths at the hospital. Keep in mind, this was in the middle of the winter. It's Maine, we have a lot of snow, people are bringing their boots in. Ultimately, I believe what the hospital used instead was mats that could be regularly cleaned. But it is still, it's not out of the realm of possibility, certainly.
Okay, thank you. Okay, so we had another question and maybe you can answer, or maybe this person can follow up later, but they're asking the overall mortality rate for the 24 or so humans who have been infected with H5N1 strains.
Yeah, so those 24 people since 2021 is what I'm sure they're referring to, which I spoke about, don't actually have the mortality rate for those 24, but I actually would like to point out that that includes all H5N1 infections in people, so possibly and actually definitely more than just the clade 2344B, which is circulating in the US. And also, I'd like to point out that historically, the mortality rate for H5N1 in humans has been around 50%.
Okay, thank you. And maybe one more question before we move on to Dr. Stapleton. How do you balance the need to keep the public safe from the avian flu without destabilizing the environments frequented by wild, potentially positive flocks?
Yeah, I think this is, kind of one of the ultimate questions. So one I certainly can't answer at the moment, but is a good question and something I think we kind of all should be thinking about. I think there's more information that we really need on what public safety means for avian influenza. And I do hope to see more conversations in the future about how we can keep that balance.
Great, thank you so much, Ms. Kruger. Okay, for Dr. Stapleton, we do have some questions for you. So one question we had was, how many of those identified outbreaks were a result from antibiotic-resistant bacteria?
Thank you. Yeah. So to plug a publication in the Journal of Clinical Microbiology, it's called Antimicrobial Resistance in Multi-State Outbreaks of Non-Typhoidal Salmonella Infections Linked to Animal Contact, United States 2015 to 2018. So just a subset of the year time frame that I covered. The lead author is Aaron Fry. In that publication, 13 of 23 backyard poultry associated outbreaks had antimicrobial resistance detected. We have a similar publication in the works to document kind of the latter time frame. Certainly, we always are constantly monitoring antibiotic resistance during these outbreaks and work very closely with the National Antimicrobial Resistance Monitoring System to keep a finger on the pulse of that. Thank you for the question.
Thank you. Okay, and we had another question. How are the backyard poultry becoming contaminated with salmonella?
Oh, interesting question. Backyard poultry can acquire salmonella from a number of different possibilities, if you will. Salmonella naturally lives in the GI tract of backyard poultry, and they can very often appear healthy and clean. They very commonly could pick it up from an environmental reservoir somewhere in the production system. They could acquire it from another bird, even if it's a different type of bird. So a chicken could, in theory, share salmonella to a duck. They could acquire it from, say, wildlife or pests that they might interact with at the home environment. It could potentially be in feed as well. So these are all possibilities, and it's certainly very diverse in how backyard poultry could pick up salmonella.
Okay, thank you. Another question we had is, if the sources of the backyard poultry were NPIP farms, would this not largely eliminate this problem? And I don't know what NPIP means, but
Certainly, yes. Yeah, so that stands for the National Poultry Improvement Plan, which is a United States Department of Agriculture run program. It is primarily focused on the health of the birds. And that program, I guess, was begun to help eliminate certain pathogens that have animal health consequence. So here we're talking about salmonella that does make the birds sick. So Salmonella pylori and Salmonella gallinarum. The short answer to this question is no, because the NPIP program is particularly focused on monitoring and eliminating those the poultry affecting species of Salmonella, like Gallinarum and Pylori. There are aspects of NPIP that monitor for or essentially farms can elect to voluntarily participate in an NPIP program. and they can meet specific standards for monitoring salmonella, which could include salmonella of human consequence like Salmonella enteritidis. So MPIP and their voluntary standards are certainly part of the picture when it comes to mitigating and learning more about prevention of Salmonella on farms. But what we do find is that very often when we trace back sources of poultry during our outbreak investigations, and we collaborate with industry partners to inform them about the link between human illness and Salmonella within their birds, they are MPIP certified and meet MPIP standards. And then it's a matter of working with those partners to continue to look at their practices and identify ways that can mitigate Salmonella that's of human consequence, a human health consequence, if you will. Thank you so much.
Thank you so much, Dr. Stapleton. And we will end the questions for now. If you have any other questions for today's presenters, we've included their email addresses on this slide and on the ZOHU Call webpage for today's webinar, also in the newsletter. A video will also be posted within 30 days. Next slide, please. So please join us for the next ZOHU Call on May 1st, and thanks for your participation. This ends today's webinar.